A grinding you can't hear, destruction you can't feel, and a problem that affects every third person. Today, Doctor versus AI avatar. And we're starting the knowledge battle. Today, we're tackling a topic that has been destroying the teeth of millions of people for years, while they simply sleep. This is bruxism. And doctors with 30 years of experience will go head to head with their AI versions. Who will explain it better? Who will dig deeper? And who will finally help viewers understand what's happening to their teeth while they don't even suspect a thing? On the left, we have our experts. Dr. Tatiana, gentle, clear, and human. Dr. Andre, structured, logical, and scientific. On the right, their AI versions. Tatiana's avatar, in a strict scientific style. Andre's avatar, statistics, protocols, and numbers. Ready? And my first question is, why do we grind our teeth?
Bruxism, or nighttime teeth grinding, is one of the most common hidden problems we encounter in patients at our clinic. The danger is that while asleep, a person can clench their teeth 5 to 10 times harder than during the day. This puts enormous strain on the teeth, muscles, and the temporomandibular joint. And the most insidious part is that bruxism develops unnoticed. A person sleeps and doesn't hear the grinding, but wakes up with a feeling of heaviness in the jaw and pain in the temples. The teeth become shorter, cracks and chips appear. The teeth become sensitive to cold and acidic foods. We see patients who lose about 1 millimeter of enamel over several years, and the patient has no idea why.
Bruxism is a parafunctional activity of the masticatory muscles that occurs predominantly during the superficial phases of sleep. Clinical data. Prevalence ranges from 8 to 31%. Up to 85% of cases remain undiagnosed. The force of nighttime clenching reaches 250 to 300 newtons, which is 5 to 10 times greater than normal chewing force. Enamel wear accelerates by 3 to 5 times. The main mechanisms are dysregulation of the central nervous system, increased reactivity of the masticatory muscles, and disruption of the sleep-stress cycle.
Viewers, vote for which explanation makes more sense to you, the human one or the artificial intelligences. And we continue. How dangerous is bruxism?
The problem with bruxism isn't just tooth wear. It affects 3 areas. First, the teeth. They wear down, break, and crack. Second, the muscles. Overstrain causes headaches and a feeling of tightness. Third, the joint. Clicks, pain, and limited mouth opening may occur.
Bruxism is a significant risk factor for microcracks, hypersensitivity, pathological tooth wear, and temporomandibular joint dysfunction. In the presence of occlusal disorders, the rate of hard tissue destruction increases 2 to 3 times. Nocturnal muscle hyperactivity increases the load on joint structures and can lead to inflammatory changes.
But what should we do? Attention viewers, now comes the most important part.
The first step is making custom night guards. They protect the enamel, reduce pressure, and relieve stress on the joint.
Store-bought mouth guards are not suitable. They can alter your bite and make the problem worse.
Second, it's about relaxing the jaw muscles. Massage, exercises. Sometimes physiotherapy is required.
Third, stress reduction. In 80% of cases, the development of bruxism is related to emotional tension.
And fourth, monitoring daytime clenching. Most patients clench their teeth during the day and don't even notice it.
Evidence-based treatment methods. Occlusal night guards reduce the load on the teeth and joint by 60 to 70%. Control of daytime parafunction. Relaxation training reduces the frequency of nighttime episodes by 30 to 40%. Stress management. Psycho-emotional triggers are the leading factor in 70 to 80% of patients.
The main thing is not to wait until chips or cracks appear in the enamel.
The sooner you consult a specialist and start treatment, the easier it will be to solve the problem.
Early diagnosis is a key factor.
The treatment protocol should be individualized.
Doctors versus their AI avatars. Today we discussed one of the most hidden yet dangerous dental problems. If you recognize yourself in these symptoms, don't put it off. Have your teeth, muscles, and joints checked by a specialist. Stay with us. It will only get deeper, more precise, and more interesting from here. And remember, when a doctor and artificial intelligence join forces, the patient wins.